Hello and welcome to a discussion on the histology of the male reproductive system. We'll start with the testis, then we'll look at the ducts, then we'll look at the accessory glands. Right. The testis is involved in spermatogenesis and steroidogenesis, which is basically the production of sperm and androgen hormones, respectively. Right. And you'd remember from your embryology that the testis was going to originate mainly from the medullary cords, right? And for us to have normal testis development, it would be highly dependent on the Y chromosome, where you also talk about the WT1 gene and the SOX9 gene, right? Which is why WT1 gene malformations will lead to Wilms tumor, which is also linked to the Wagner syndrome, which the G there simply stands for gonadoblastomas. So you're also going to get genitourinary malformations. You also need the SF1 gene. You also need the DAX1 gene that help in development of the testis, right? And as a thumb of rule, the genitourinary structures mainly come from intermediate mesoderm. And before the 7th week, you'd say that there was going to be an indifferent gonad where you can differentiate between male and female until the primordial germ cells actually invade the primitive gonad and have an inductive effect. Right. So the testis is what we're going to describe first, and structure-wise, the testis is going to have a very thick tunica albergini, which is basically the capsule, and it sends septa into the testis, and it divides the testis into 250 pyramidal compartments, which we call testicular lobules. Right. The inner layer of the tunica albergini is what we call the tunica vasculosa. Vasculosa because it's loose connective tissue that contains blood vessels. Right. So the inner layer is the tunica vasculosa, right? And the outer layer doesn't have all that. Right. So if you look at each testicular lobule, it's going to have 1 to 4 seminiferous tubules. And between the tubules, you find sparse interstitial tissue, which we call the Leydig cells, or the interstitial cells of Leydig. Those Leydig cells, they secrete testosterone. They're the same Leydig cells which, in our discussion on genitourinary embryology, we say that you're going to have testosterone production during the 8th week intrauterine life. They're the same cells which are going to come from the mesenchyme that existed between the developing sex cords. Then, of course, in the seminiferous tubules, we're going to find another cell, which is the Sertoli cell, which we said embryologically, it originates from the surface epithelium. Those are two different cells with two quite distinct hormonal functions and basic functions, but they do work hand in hand. So you have that tunica albergini divides our testis into compartments. Your lobules, each lobule has 1 to 4 seminiferous tubules. Right. Then, if you look at the seminiferous tubule, they're lined by a stratified or a complex stratified epithelium, which we call the germinal epithelium. Quite different from the germinal epithelium, which we described in the video of the female reproductive system. Right. And the epithelium, if you look at the tubules, you divide them into a basal compartment, then an abdominal compartment. The basal compartment is what houses the spermatogonia, the niche of the spermatogonia, which is simply renewing themselves and also undergoing spermatogenesis and spermiogenesis. Right. The Leydig cells that I described as being in the interstitium, they're going to be round to polygonal and their nuclei is quite central. So there is central nuclei, and shape-wise, the cells are round to polygonal. The cytoplasm of the Leydig cells is highly acidophilic due to the abundance of lipid droplets. Remember, these cells are involved in steroidogenesis. They are producing a steroid hormone, in this case, testosterone. So they appear quite acidophilic. Unlike our Sertoli cells, which are inside the tubule, shape-wise, they are columnar to pyramidal. And those Sertoli cells are joined by gap junctions, and they form part of the blood-testis barrier, which is the tightest blood barrier in the body. Right. Function-wise, the Sertoli cells have an exocrine and an endocrine function. They produce androgen-binding protein to concentrate the testosterone. They also produce inhibin. They produce Mullerian-inhibiting substance, which is quite essential in embryonic development in arresting the development of the Mullerian duct or the paramesonephric duct, which in the female normally would form the uterine tube, the uterus, and the upper part, or basically the vagina, right? The Sertoli cells are also involved in phagocytosis. They phagocytose sperm debris. They also support and nourish the developing sperm. Right. And from your gross anatomy, you'd also remember that the testis is covered by a serous sac of peritoneum, which simply is going to be our tunica vaginalis. Right. It doesn't, however, completely cover your testis. Right. So each seminiferous tube is going to be about approximately 50 centimeters long, and those seminiferous tubes can range from up to 80 centimeters in terms of length, right? And width-wise, depending on the text that you use, they're going to range from about 150 to about 250 micrometers in diameter, right? And since they say the seminiferous epithelium is quite unusual, or it's a complex stratified epithelium, the type of cells that you find there are the Sertoli cells and the spermatogonia. Right? And I've told you the functions of the Sertoli cells, and the spermatogenic cells are the ones that are going to be involved in spermatogenesis. Right? Then you also find something known as the tunica propria or the lamina propria, which we also call the peritubular tissue, right? And that's connective tissue that lacks the typical fibroblasts that you find in normal connective tissue. Remember, fibroblasts from your general histology, they're the most abundant type of cell within the connective tissue, right? And in men, it actually has 3 to 5 cell layers of what are known as myoid cells. Myo meaning muscle, oid meaning like. So they are muscle-like cell. Right. So they demonstrate features that resemble smooth muscle cells. Hence, we call them myoid cells. Right. Then the Leydig cells, I've mentioned them. I've talked about how they produce testosterone. I've talked about how they actually come from mesenchyme between the developing sex cords, right? And those cells, in some instances, they actually show lipofuscin pigment granules. If you remember your granules or your pigment granules from your general histology, right? Then, from a bit of a pathological point of view, you may have what are known as Ranke crystals, right? Like those are rod-shaped crystals that may actually be seen in your Leydig cells, right? Then you'd need to remember your spermatogenesis, right? Where you start from a spermatogenic phase, you get to a spermatocyte phase where you now have the meiosis, then you have the spermatid phase, which then basically becomes spermiogenesis, right? And if you look at the spermatogonia cells themselves, they're the type A spermatogonia cells, which are quite dark and have an ovoid nuclei. right? Then you have the type B, which have now committed. They have generally like a spherical nuclei, and they're the ones that have now committed to to become or to streamline now to start spermatogenesis and not act as a basal niche of stem cells, right? Quite interesting, right? Great. Then you may also need to remember the cycle that occurs in these seminiferous tubules, right? So you find that the cells are not arranged randomly within your seminiferous epithelium or the seminiferous tubules themselves, right? And spermatogenesis approximately takes about 74 days, right? And you see waves of spermatogenesis occurring within these seminiferous tubules histologically, something that I'm not really going to dwell much on, right? Then if you then look at the other parts of the male reproductive system, if you go to the duct system will divide it into the intratesticular ducts and the extratesticular ducts. The intratesticular ducts are the ones that are going to lie within the testis. Then the extratesticular ducts are going to lie outside. Right? So at the end of each seminiferous tubule, you find what we call the tubular recti or the straight tubules. Right? These tubular recti are going to be lined by Sertoli cells proximally, and distally they have a simple cuboidal epithelium. And they're the ones that are going to carry the sperm from the seminiferous tubule into what we call the retitestis. The retitestis will have a simple cuboidal epithelium that is supported by a dense, irregular connective tissue. From the retitestis, they lead into the efferent ductus. The efferent ductus are described as having a scalloped epithelium with alternating tall ciliated columnar cells and shorter non-ciliated cuboidal cells. The shorter non-ciliated cuboidal cells are the ones that are going to help in a phagocytosis or absorption, or maybe if you call it reabsorption of sperm debris along their movement. Right? And there's little smooth muscle supporting this efferent ductus. So you have little smooth muscle actually supporting the efferent ductus, right? Then in men, you have approximately 20 efferent ductus that connect the channels of your retitestis, right? So you have straight tubule, which is your tubular recti. Then you get to the retitestis. Then you get to your efferent ductus, right? Then from the intratesticular ones, you then get to the extratesticular ducts, right? With this one, you can then mention the epididymis, the vas deferens, then the ejaculatory ducts. The epididymis has a head, a body, and a tail, which I'm sure you remember from your gross anatomy. It's a crescent-shaped structure that lies along the superior and posterior poles of the testis, right? It's about, depending on your text, lengthwise about 7.5 centimeters and length, right? Others will write even up to 6 meters, right? Depending on how you're viewing it. If it's uncoiled, it actually then gets all the way there. Right? So the duct is the one that is actually highly coiled and can be actually up to 6 meters, 4 to 6 meters in length. But just the part that is higher up, which is not the duct, the head part, that's about 7.5 centimeters in length, right? It is pseudostratified columnar cells with small basal cells and principal cells. And there's the presence of stereocilia, which I'm sure you guys would remember from your general histology, where you talked about apical surface modifications on your epithelia. right? You mentioned something that is stereocilia, which are actin-based protrusions on auditory and vestibular sensory cells, as well as also found in the epididymis and the vas deferens. Right? That's basically stereocilia. And they are sometimes branched, unlike your cilia. That's one of the differences with cilia. And cilia are actually typically shorter than your stereocilia from your discussions on general histology. Right? And there are two muscle layers in the epididymis, except in the tail where they become three, where it then becomes continuous with the vas deferens. Right? And the cells that are there, which are your principal cells and the small basal cells, the principal cells are almost 80 to 100 micrometers in height, right? And they are quite shorter when you get to the tail of the epididymis, right? And they do have those modified microvilli on their apical end, which are stereocilia, right? And the basal cells, you'd remember that the ones that are basally located, they're quite small, they're round, they're actually compressed by the overlying principal cells, right? And they rest on the basal lamina and they produce, or they act as stem cells, right? The epididymal cells function in both absorption and secretion, right? Then the ductus deferens or the vas deferens has three muscle layers. There's a fibroelastic lamina propria with sparse stereocilia. The epithelium there is pseudostratified columnar, right? And lengthwise about 45 centimeters. And you remember it's one of the contents of the spermatic cord, right? And at some point it crosses the ureter, right, in the region of the ischial spine, if you remember your male pelvic anatomy, right? And it's actually the longest part of the excurrent duct system, right? Then it is terminal part. Remember, it dilates to form an ampulla, then a duct, which then joins the duct of the seminal vesicle to form the ejaculatory duct, right? The two vas deferens on the posterior surface of the bladder, they will separate your two seminal vesicles, right? The ejaculatory duct is pseudostratified and simple columnar epithelium. It also consists of a fibroelastic lamina propria, right? And the ampulla of our vas deferens, it actually consists of taller branched mucosal folds, right? And the urethra, I've described that with the histology of the urinary system, so you can refer to the previous lecture on urinary system histology. But just for completeness sake, the prostatic urethra is going to have transitional epithelium. The membranous urethra has a pseudostratified and the stratified, as well as the penile urethra, but the distalmost part of the penile urethra will have a stratified squamous epithelium. Right. Straight into the accessory glands, we have the prostate, we have the seminal vesicles, we have the bulbourethral glands, then we have the penis itself. Right. The seminal vesicles are paired and they're elongated and highly coiled, such that if you look at the gross anatomy, you describe them as being 5 centimeters in length. But if you look at the histology, they're up to 15 centimeters when uncoiled, which is something that is quite different. Right. And they have a simple to pseudostratified columnar epithelium, and they also have quite an abundance of elastic fibers. So they have a fibroelastic lamina propria, right? They secrete a whitish yellow viscous material, which you must have discussed in your reproductive physiology, right? Then the prostate, it consists of tubulo-alveolar glands, right? And it's the largest accessory sex gland, right? And you divide it into different morphological and functional zones, right? It is a transitional zone where you find the mucosal glands, a central zone where you have the submucosal glands, and the peripheral zone where you have the main glands of the prostate. The epithelium there is simple pseudostratified, right? columnar, that is, and you find what are known as corpora amylacea that are present in old age, different from the corpora arenacea, which we're going to describe with the histology of the pineal gland in the central nervous system, or even the discussion on endocrine system histology. Right. Then you have something known as prostate-specific antigen, which can be used as a tumor marker. Then there's the benign prostatic hyperplasia, which is quite common in old age in males. Then there's prostatic carcinoma. Prostatic carcinoma is quite common in the peripheral zones of the prostate, whereas benign prostatic hyperplasia is common in the transitional zones where you have the mucosal glands. Right. The prostate consists of about 30 to 50 tubuloalveolar glands, which are arranged in concentric layers. Right. Now, if you remember, from the gross anatomy point of view, you divide into lobes: an anterior lobe, a posterior lobe, two lateral lobes, and a median lobe. The median lobe is the one that bulges into the bladder as the ovula vesicae. The anterior lobe is the one that you said uniquely it lacks glandular tissue. Right. Then the central zone is the one that surrounds the ejaculatory ducts. It contains about 25% of the glandular tissue. Right. The peripheral zone contains about 70% of the glandular tissue. Right. Meaning 25, 70, then you're left with transition, which is about 5% of the glandular tissue within the prostate. Right. And it's quite closer to the urethra, and it can actually compress the prostatic urethra, causing difficult passage of urine, which is dysuria, which is going to be painful. Right. Then the glandular epithelium within our prostate, it's influenced by hormones, dihydrotestosterone, converted from testosterone using the enzyme 5-alpha reductase. Those things are basic principles in your physiology. Right. Then I won't talk much on cancer of the prostate, but it'll be quite key to remember that the grading system for prostatic cancer is the Gleason score. Right? The grades range from 1 to 5. Right. Then the last two there's the bulbourethral glands, which are also known as the corpus glands, which are mucus secreting glands with a simple columnar epithelium. They're tubuloacinar, and they're shaped like they're sized like a pea, because they're pea-sized or pea-sized structures. Right. These are bulbourethral glands. Right. And the glands are in the deep perineal pouch in the male. The ducts, however, pierce the perineal membrane, right? The inferior urogenital fascial layer, and drain into the superficial perineal pouch via the penile urethra, right? So they actually secrete what we call the pre-ejaculatory fluid, right? Such that semen, if you remember semen, it consists now of the sperm, then you have secretions from the prostate and the seminal vesicles, right? Then the bulbourethral glands are producing our pre-ejaculatory fluid, right? I won't go into the physiology of semen. And the penis has corpora cavernosa, 2 of them, and corpus spongiosum, which are the mass of erectile tissue. Right. And the corpora cavernosa are surrounded by tunica albergini, right? And you'd also remember that the corpus spongiosum is the one that dilates and continues into your glans penis, right? So that's the basic histology of those parts of your male reproductive system, right? We'll now go into the pictures, right? This is a classic picture which shows the testes. Right. So these right here, maybe we could start with there. We have a blood vessel right there. This anyone can pick up. Right. There's another blood vessel right there. Right. Then this is the septal connective tissue that I was talking about, where the blood vessels are. That's septal connective tissue, right? Then this here is a lobule. It's in between the septa. This whole thing, that's a lobule, right? Then this on the outside here, that's the connective tissue in the tunica or vagina, right? Right. These are tubules. These are cross sections. These ones where you don't see the lumen, those are tangential sections, right? So you can see the lumen there. This is higher magnification. The basal cells there, those are your spermatogonia, right? Then these ones, which are here now, those are your spermatids. Right? Not so important to just grasp, but these are just pictures of testicular tissue that I'm showing you now, right? Then this again here is testis tissue, right? Here we can see tunica or vagina again on the outside there. Those are lobules. All these are lobules, right? This is higher magnification. This insert, yeah. This one, right? That's another lobe. That's another seminiferous tubule, right? From this one, these are seminiferous tubules, right? These are your rated testes. These tubes here, those are rated testes, right? So it becomes quite interesting if you understand what these structures are. This shows again a rated testis, right? So that's rated testis right over there, right? Then maybe a picture of efferent ductus and the epididymis. Right. This picture here, these here are the ductile differences. Right. This picture is the ductile differences. Right. So your efferent ductus, those are ducts of the epididymis on the other side there. Right. Then these are the smooth muscle cells that I was talking about, the myoid cells that outside there for this higher magnification. Right. Then there's a classic picture, yeah. That's stereocilia and the epididymis. Stereocilia right over there. That's the lipofuscin pigments that I was talking about. That's pigment right over there. Right. Then this is just spermatic cord tissue, right? With fast difference right over there. Then this here is prostate gland tissue, right? There we can see some bit of capsule of the prostate right over there. Right. Then this right over there. Right. That's the prostatic concretion that I was talking about, your corporal amylase. Right. That's higher magnification. You can see the amylase there. Oh, there's a classic picture of seminal vesicles. Right. You can see some smooth muscle right on the outside, yeah. That's smooth muscle. And there's connective tissue here. And those are the folds of the mucosa right over there. Then here you can see the epithelium, which is a simple columnar pseudostratified. And this is the loose connective tissue, lamina propria. Right. So that's just about it. Thank you for watching.